This is the beginning of the second section of our presentation, which will be focused on body image. This includes eating disorders, body dysmorphia, and gender dysphoria. An eating disorder is defined as an unhealthy relationship with food. This doesn't mean that someone eats unhealthy foods, but they don't eat enough, they eat too much, they hyper-focus on food, or they eat a lot and then try to get rid of the calories they just consumed. There are many different types of eating disorders, but we are going to be going into specifics of 3 of them.
Anorexia nervosa, bulimia nervosa, binge eating disorder, and eating disorder not otherwise specified, which is EDNOS, also known as other specified feeding or eating disorder, OSFED, are the 4 common eating disorders. We are not going into the specifics on EDNOS and OSFED because it isn't one identifiable thing. This is any eating disorder that has some aspects of anorexia, bulimia, or binge eating disorder, but doesn't completely fit the criteria of any of these labels.
Before we get started on this topic, I want to share a quote. "You are not a mistake. You are not a problem to be solved. It is possible to treat yourself with an outrageous kindness beginning today. Compulsive eating is only the symptom. Believing that you are not worth your own love is the problem. Go for the love. You will never be sorry." Janine Roth. The first eating disorder we are going to be talking about is anorexia. The main characteristics associated with anorexia are self-starvation and excessive exercise. Someone with anorexia will normally have a lower than average body weight. They typically have a distorted image of their weight and an intense fear of gaining more. They often won't eat and may exercise excessively to try and control their weight. Anorexia is not completely about food. Most people with eating disorders develop them because they associate their weight with their worth or value.
Some of the symptoms of anorexia include extreme weight loss, fatigue, insomnia, dizziness or fainting, finger discoloration, thin hair, loss of periods, dry or yellow skin, sensitivity to cold, dehydration, swelling in arms and legs, and eroded or discolored teeth, and calloused knuckles from vomiting.
Some warning signs that may be noticed by family and friends include irritability, insomnia, extreme preoccupation with food, weight loss, abdominal pain, dizziness or fainting, sensitivity to cold, anemia, which is low iron, social withdrawal, feeling hopeless, an all-or-nothing way of thinking, perfectionism, layered clothing, especially when it's not weather appropriate, denying hunger, and avoiding meals.
There are a lot of health risks that come with anorexia. Some of the less severe side effects include lack of energy, skin problems, dizziness and headaches, dehydration, shortness of breath, always being cold, bloating, constipation, hair loss or finer hair, stomach pains, a decreased metabolism, water retention, and hormonal issues.
There are also quite a few severe issues that come with anorexia. These include an irregular heartbeat or cardiac arrest, low blood sugar, loss of bone mass or osteoporosis, meaning that bones break easier and won't heal as well, kidney and liver damage, depression, cathartic colon from laxative abuse, insomnia, anemia, infertility, electrolyte imbalances, low potassium, which is the most common cause of nighttime heart attacks, and even death. So the next ED we are going to discuss is bulimia. Bulimia is an eating disorder where the person will eat a lot of food and then purge in an effort to get rid of the calories. They might purge by vomiting or using laxatives, weight loss supplements, or other methods. It is important to note that the weight of someone with bulimia might not change. If anything, they might gain weight.
The symptoms of someone with bulimia includes fixation on body shape or weight, fear of gaining weight, repeatedly binging on food, feeling loss of control while binging, forcing themselves to vomit or exercise excessively to make up for the binge, using laxatives, weight loss supplements, etc. after eating when they aren't needed, again to make up for the binge, fasting or restricting food intake between binges, excessively using weight loss products when they aren't needed, and refusing to take insulin or taking less than needed if this person is a type 1 diabetic.
Some warning signs for family and friends to look for include this person constantly worrying or complaining about weight, having a distorted negative body image, binging, not wanting to eat in public, bathroom visits during or after meals for extended periods of time, excessive exercise, sores, scars, calluses, or discoloration on knuckles or fingers, damaged teeth or gums, weight fluctuations, and swelling in hands, feet, face, or cheeks.
Some of the health risks of bulimia include tooth decay, gum disease, tooth sensitivity, Russell sign, which is discolored or calloused fingers, mouth or throat sores, and a damaged esophagus, even to the point of bursting. All of this is due to frequent vomiting.
Some of the other health risks include imbalanced electrolytes, heart issues, hormonal problems, which can cause fertility issues that can be lifelong, digestive issues, muscle weakness that can lead to heart failure due to ipecac syrup, anxiety, depression, low self-esteem, suicidal thoughts and actions, as well as drug and alcohol abuse. Next up are binge eating disorders. In this video, we will be referring to it as BED. This is very similar to bulimia, but different in one big way. People with this eating disorder will repeatedly binge on large amounts of food, but they won't try to compensate for it. This means that they won't try to purge, and they won't exercise excessively to get rid of all the calories they just consumed. During a binge eating episode, intense hunger and unfulfillment is a psychological response.
The symptoms of BED include binge eating episodes, which generally will have at least 3 of these behaviors. Eating much faster than normal, eating until they're uncomfortably full, eating large amounts of food while not physically hungry, eating alone because they are embarrassed of how much they eat, and feeling disgusted with themselves, depressed, or guilty after binge eating. Someone with BED will have a lack of compensatory behaviors, which means they won't try to purge the food after binging, and they won't excessively exercise to try to make up for it. They might also feel distressed about binging.
Warning signs for family and friends include seeing food wrappers or containers around their house or room, indicating consumption of a lot of food. They may be overweight for their age or height, but not all people with BED are overweight. They may have a long history of trying to diet or feel desperate about their ability to control their food intake, and they may eat throughout the day with no planned meal times.
Some of the health risks of BED include weight gain or obesity, which can lead to high blood pressure, high cholesterol, heart disease, type 2 diabetes, joint problems, and sleep-related breathing disorders. Some non-weight related health risks associated with BED include emotional and mental illnesses, reflux, social isolation, and poor quality of life.
I also read about a study meant to simulate binge eating disorders and study the effects on the human body. The results were very interesting, so I wanted to include it in this video. The researchers used 6 men for this study. They ate 6,200 calories a day, which is twice as much as normal, and got no exercise. They ate a carb and fat-heavy diet, which includes food like hamburgers, cookies, and pizzas, which are the types of foods that someone with BED would typically binge on. Within a week, the men gained about 8 pounds on average and developed insulin resistance after just 2 to 3 days. Insulin resistance is what leads to type 2 diabetes. It's not a good thing. This experiment is very similar to BED and shows what it does to someone's body. I'll leave a link to the article in the description of this video for you guys to check out if you're interested.
Now that we have covered the most common eating disorders, let's talk about how to help someone dealing with one. Always make sure to listen and to encourage them. If you think they are in immediate danger, call 911. Encourage them to get professional help, whether that is going to a therapist, talking to a school counselor, or calling a hotline.
Avoid commenting on their weight, and don't blame or shame them for being in this situation by saying stuff like, just eat something, or you're just hurting yourself for no reason. Instead, use I statements. For example, I find it hard to watch you go through this, or I get scared when I hear you throwing up, etc. Ask what they need or what you can do to help. Also, remember to use what statements, not why statements.
You should also avoid oversimplifying the situation and giving simple solutions. Don't say, just eat, or all you have to do is accept yourself. If it was that easy, they would have already done it by now. This is not a simple issue. Make sure to reiterate that recovery is always possible and be there for them. This is not an easy thing to go through.
Thank you so much for supporting us. There will be information and resources in the description of this video for you to check out if you're interested. And we would appreciate if you would like, subscribe, comment, and share our videos so this information reaches as many people as possible. If you have any questions, feel free to leave them in the comments. Thank you.